Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call, and today we are looking at the COVID-19 crisis currently roiling China and Hong Kong. Cases and deaths there are the highest they've been since the start of the pandemic more than 2 years ago. Stephanie Desmond talks to Yanzhuan Huang from the Council of Foreign Relations and Seton Hall University. Let's listen.
Yanzhuan Huang, thanks so much for joining me.
Thanks for having me, Stephanie.
So you are an expert in China and Hong Kong and public health, and you're the perfect person to have today because we keep hearing of a big surge of COVID cases in that part of the world. So China was first to recognize COVID-19 more than 2 years ago. Why is this happening now?
Well, I think that is a good question, right? I think in part, right, China is now experiencing this Omicron wave, right, later than many other countries because its strict zero COVID strategy, that shielded the population from this new highly transmissible, Omicron wave. But we know what this is, so highly transmissible, even the best defense, cannot prevent the virus from infiltrating Chinese borders. So it finally arrived in the mainland China in early March. So this now we are seeing the largest outbreak, since the Wuhan outbreak in early 2020.
Mm-hmm. Talk to those of us who don't know what the zero COVID strategy is. Could you just give us a quick explainer?
Well, the zero COVID strategy, right, came into place after China, brought the situation under control in Wuhan and other parts of the country. So they want to sustain the achievements they've made, right? In early April, China lifted the lockdown on Wuhan. Essentially, but since then, China rarely reported any local new transmissions. In fact, the daily increased case count, rarely exceeded 100. But this is for a country with 1.4 billion people, right? Until I think very recently. So that was quite impressive. While China was able to do that, thanks to a campaign, that focused on mass PCR testing, aggressive contact tracing, and quarantine, and if necessary, lockdown measures. So under that zero COVID strategy, right, even one like a single local transmission, right, would trigger immediately mass testing, aggressive contact tracing, quarantine, isolations, and the sealing of neighborhoods and even the entire city, and in this way, they were able to reset the cases, right, to zero, right? And certainly, right, that strategy has undergone some changes. Now, Chinese public health authorities no longer insisted that they have a zero COVID strategy. Instead, they said we're pursuing a dynamic zero COVID or dynamic clearance strategy. So they recognize that it's impossible to eradicate the cases, but still, right, the fundamental components of that strategy remain there.
These are really drastic measures, though. I mean, you don't see that in many parts of the world. There's one case and you shut the whole place down. I mean, that's really only possible, I guess, because of the government of China. Is that right?
I completely agree. I think if there's a country, right, that can pursue this approach in such a effective way or efficient way while still receiving robust public support, that got to be China, right? It just shows this resilience of the Chinese state. When the leaders are committed to doing something, it can effectively mobilize the resources and capabilities to get things done.
But I'm not sure that folks in many other countries would stand for that.
Well, yeah, it's just, that they might be impressed by Chinese achievements, but, that approach fundamentally is not replicable, right? In part, but because of the lack of, that strong state capacity. But, also, I think it probably should not be replicated, right? Mm-hmm. Because there's very high social economic cost. And also, right, I think, many of the people in other countries probably would not accept it, right? They want to sacrifice, the liberty, the freedom, the human rights, for the maximum protection of health.
Mm-hmm. So the folks in China, they're facing this Omicron and this Omicron 2 that we're seeing, right? Very contagious. And they've got very little natural immunity because very few people have had COVID. And now it's becoming more evident that, for example, the elderly population has not been vaccinated as much as younger populations. And that's quite a deadly combo. I'm curious how and why elderly folks were not prioritized.
Well, that is a good question. In fact, we look at China's mass vaccination strategy. From the very beginning, elderly people were not prioritized. Well, this official explanation was that they didn't have the clinical trial data for the elderly, right? Because the phase 3 clinical trials, the elderly people were not included. So, I think they were not confident, right, that including the elderly in the mass vaccination campaign and prioritizing them would be a good idea. But, certainly, right, then you have this zero COVID strategy, but that shielded the population from the infection, right? That so people develop that false sense of security. But this is the same, right? We found the same problem in Hong Kong, right? The elderly people simply felt that they were pretty safe. Why bother to get vaccinated? There's potential, side effects. Although, I think there's also problem public messaging, right? Because when you're telling a person who's aged over 80, right, there's that, I'm concerned about the side effects, right? That I think, it's kind of doesn't make much sense because I think, you need to balance the risk, right? Which, a highly transmissible, potentially deadly virus, against the potential side effects, which one is a bigger problem, that it's a no-brainer. So, I think, that explains why, for China, even today, right, that you still have the 52 million people who are aged over 60 not fully vaccinated. I mean, by fully vaccinated, we talk about the 2 doses of the inactivated vaccines. And among those who are aged over 80, the number is even larger, right? So, about half of those elderly who are not fully vaccinated actually are aged over 80.
So it's, we're watching cities be locked down and we're watching people and countries being locked down. I know that folks weren't able to transit through Hong Kong for a while. How does this stop?
Well, I think it is, if we really want to avoid the disaster in Hong Kong, right, it is important, right, instead of, continuing pursuing that zero COVID strategy, which, essentially does not differentiate, right, who should be really protected, because all they care about are the infections, the number of infections. So that is why until very recently, they didn't even introduce this triage procedure, right? Because everybody, right, no matter you mild case, symptoms or not, actually are hospitalized. That doesn't really make much sense. And so, I think, the new strategy should really, right, shift it toward protecting those who are old or elderly, those who are immunosuppressed. So, certainly it's important to have the antiviral, available to them. But I think it is equally important to have the more effective vaccines administered on the elderly population, right? That, I think they should all be administered with booster shots as soon as possible. So China should, immediately approve the use of the BioNTech Pfizer's mRNA vaccines. It's been like more than 1 year. They still haven't approved it.
Mm-hmm. So there's a lot of people in China who have not been vaccinated, who have not gotten sick yet. Zero COVID policy isn't quite working. What do you see happening in the coming weeks and months?
Well, we are seeing some flexibility being introduced by the implementation of that zero COVID approach. Just talk about the introduction of the triage procedures. They no longer require, everybody infected, to be hospitalized. For those who are asymptomatic or with mild symptoms, they are going to be subject to the centralized quarantines. And they have also, redefine COVID cases, so make it easy for people, who are infected to be discharged from the hospitals. Recently, the Chinese President Xi and also National Health Commission, they've revised the guidelines, so focus on more targeted and more flexible approach. But, there's certainly the problem is that the fundamental goals remain zero COVID, that they have not fundamentally changed in the policy goals. So, I think in the coming weeks or months, it is important for China to consider shifting to a mitigation-based approach, at the time when the public support for that strategy is rapidly in decline, and the social economic cost associated with that draconian approach is increasing very fast.
Mm-hmm. So do you think it gets worse before it gets better?
Well, so far we haven't seen what the cases in China peaked, right? In Hong Kong, we know, the cases peaked in early March, but I think for China, it may still take a couple of weeks for the situation to be brought under control. The prediction is that in April, situation should be brought under control. But again, that doesn't mean eradication of the virus, right? As long as the pandemic is still there, as long as China still has such a large vulnerable population, I think even though can claim that we have brought the situation under control, you still, needs to prepare for the next round of the attack.
Are they ready?
Well, that is the good question, right? To be ready means that you need to shift it to a new strategy from containment to mitigation. But so far, again, we have seen that the government is modifying the guidelines for implementing the approach, but the policy itself, we haven't seen any fundamental change there. In fact, both the Chinese leaders and the head of the National Health Commission, made it clear, that they're going to cling to that strategy. So as long as that strategy is still in place, I don't think they are ready.
Yeah. And then, you said that the cases plateaued in Hong Kong, but it looks like they're running out of coffins, I read today, which is just a sort of frightening thought.
Yeah.
Yanzhang Huang, thanks so much for joining me.
Thank you. It's a pleasure speaking with you.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McCusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.